Okay, hi everyone. My name is Yeannakis. I'm with Disability Claims Representatives, and I am a disability advocate and a resource navigator. I'm here to talk about Social Security disability and some of the ins and outs that you might not be aware of that could help you get benefits that you desperately need. First off, once the doctor makes a medical decision and gives you a diagnosis, your first step towards Social Security is eligibility. In order to be eligible for Social Security disability, first off, you have had to have worked 40 quarters in your lifetime. You also have to have worked 5 full years out of the last 10 to be eligible for Social Security disability. That is even with an ALS diagnosis. Your quarters that are paid in generate your retirement benefit, and your retirement benefit, of course, is tied to your Social Security disability benefit. Once you've been deemed eligible, you are then going to file your claim. Filing the claim online or through Social Security is not as easy as it appears because there are a lot of pitfalls in filing your claim by using possibly the wrong diagnosis codes, not spelling out amyotrophic lateral sclerosis and putting it in the right spot. And if anybody out there is actually pending disability right now, and they have been pending more than 3 weeks to a month, something's gone wrong. Once a case goes to disability determination services, if it is not coded correctly, it could wind up in the backlog. And if you wind up in the backlog, you could have 6 to 7 months of waiting for them to find out that you have ALS, which is a quick decision diagnosis. When you're applying for Social Security disability, the 5 month waiting period and the 2 year waiting period for Medicare has been waived by Congress back in 2019, I think it was. And therefore, it is a quick decision and quick benefit. If you receive a benefit letter in the mail from Social Security after applying on your own, and you are not automatically enrolled in Medicare, something has gone wrong. In order to meet the requirements to waive the 5 month waiting period, you have to have a definitive diagnosis of ALS. Doctors sometimes and quite often don't want to make a definitive diagnosis because they're trying to balance things out so that it's not as hard for the family and the patient to deal with the diagnosis. If the diagnosis is suggested or suggestive of or possibly ALS, you run the risk of not having the 5 month waiting period waived. The cases are reviewed by neurologists at Social Security. However, they do not make a medical determination. Only your neurologist will make that. If you are diagnosed with another type of motor neuron disease, of course you will get disability, but your case will go through the normal channels and it can take 6 to 9 months to develop. If during that period of time that you are pending and you do wind up with a definitive diagnosis of ALS, it is quite easy for a representative like myself to get everything moved quickly and get the case changed over to a compassionate allowance for ALS and have it immediately decided. It is not so easy for the claimant to do this on their own because they're limited to how often they're able to talk to anybody, either at Social Security or at disability determination services. Just to clarify, your local Social Security office only handles the money and your eligibility. The state agency is the one that makes the actual disability determination. With that being said, if you have a potential of a solid ALS diagnosis and your doctor is looking to possibly do maybe another test in a month or is just not ready to make it definitive but is pretty sure, wait the month until they make the definitive diagnosis. It will save you a lot of time and aggravation and a lot of paperwork to not apply too soon. Just having motor neuron disease quote unquote, is not going to waive the 5-month waiting period. However, it still will give you disability. When the case is submitted, and when I submit a case with ALS, I try to make sure that we're using and utilizing all of the exceptions that are legal and are in the procedures and operations manual at Social Security. There's lots of loopholes that can offer patients an earlier onset date. It could also offer them better benefits for the future. One thing to always remember, you do not quit your job when you get an ALS diagnosis. You go out on medical leave, you can apply for short-term and long-term disability, FMLA, but if you quit your job, you will lose any benefits that you have that you could be getting. And also, if your company offers you short-term and long-term disability, that's going to pay you about 60% of your former income. Social Security pays a lot less. So having the short-term and long-term disability in place is very important. There's two things that we need in order to get your case approved quickly. One is a copy of the EMG, and one is a copy of the clinic note that your neurologist has determined that you have ALS, and that is corresponding with the EMG that had just been conducted. With those two documents, we can actually push your case through very quickly, but it also can take between 3 and 4 weeks just because of processing time, and they're extremely busy. And I'm trying to push cases through as quick as I can, but sometimes we can do it in a couple of days. Sometimes it'll take a month. If it goes more than a month, something's wrong. You do not need to ever apply for Medicare unless you're 65 years old and working and need it. Your Medicare is tied to your disability determination. If you are found eligible, you have a definitive diagnosis, your Medicare will automatically begin on the first of the month after you are approved, or on your onset date. The month you go into payment, which is normally the first of the month after your eligibility, your Medicare will go into effect for Part A and B. Part A pays for the hospital, Part B pays for the doctors. Part B also has a cost of $164.90 per month that will be deducted from your Social Security check. If you do not have other insurance, or when your short-term disability stops and your insurance stops, you would then be eligible to apply for either a Part C or a Part D program. C is an Advantage program tied to an HMO or a PPO, and Part D is the prescription plan for Medicare. These benefits are available to you only if you have a definitive diagnosis immediately. If your diagnosis is not definitive and you are awarded disability, you will have that 5-month waiting period to go through before payment starts, and then 2 years from when payment starts for Medicare to begin. If you apply on your own and there is a glitch, the odds of you finding out until it's too late is pretty evident. What you want to do is make sure that if you receive any paperwork from Social Security during the first few weeks, read it very carefully. If they are asking you to fill out questionnaires, you do not have a definitive diagnosis for ALS in the system. Contacting Social Security can be difficult, but you always want to contact your local field office. Calling the 800-772-1213 number is a general call line, and often you may get information that is not germane to your particular claim. If you call into your local office or go into your office if you think something's going wrong, they're going to be able to help you immediately and give you hopefully the correct information. Social Security always pays 1 month in arrears. So if you are approved, for instance, you apply in September, your first payment should be October. You'll get paid in November for October, but your Medicare will also go into effect in October. If you are also applying for other benefits, that does not preclude you from Social Security. There's a, uh, I've heard from people over the years saying that they were told that they'd have to wait a year from when they stop working, or they have to be off of short-term disability. No, all you have to do is not be earning your wages. If you are on sick leave, if you're on vacation leave, if you're on leave without pay, you can still be employed. You do not have to be unemployed. You just have to not be doing your job. And this is a big misnomer that people are hearing all over the place, which is sad because you are getting more benefits by applying right away than just waiting until you're required to when you do long-term disability. One other thing before I run out of time, if you are on Social Security disability and you are eligible for long-term disability through your benefit package from your former employer, your Social Security benefit will be offset by the amount that you're being paid by the insurance company for long-term disability. They do not let you double dip. You can double dip with short-term disability, mainly because the rules have not changed since we have had the 5-month waiting period changed. Therefore, during the 5-month waiting period, you would normally be on short-term disability and not have any other income. You can apply for Social Security and receive both during the short-term disability program. This is a lot of information to throw out in one quick session. I know we can't do any questions and answers, but I'll be available to anybody who would like to call me for a consultation or just to ask questions, or if you're having issues with either Medicaid, Medicare, or other benefits, please feel free to call. One other thing in terms of eligibility, if you have not paid in your 40 quarters, nor have you, or if you have not paid in 5 out of the last 10 years, depending on your financial situation and household income, you may be eligible for what's called SSI. SSI is supplemental security income, and it's actually basically a welfare program for disability. It's the same disability determination. You go through the same exact process. However, the SSI application has to be taken by the local Social Security office. That has to be done in person by a federal employee. Income and resources are tied to SSI. It is mainly for people who have actually never worked or were possibly a stay-at-home spouse and has no income at this point and no other benefit that they can get through Social Security. SSI is not basically it's not a living wage. So if you are not eligible for disability, you may be eligible for SSI. SSI is also tied to full Medicaid. You will not get Medicare if you are receiving SSI because you would not have paid into the system and would not have a disability determination. However, Medicaid is 100% paid by the government. There are a lot of limitations in terms of services that you can get with Medicaid. However, there's always an exception. If you are on Medicaid and are having trouble getting prescriptions and or any type of medical treatment, please feel free to call and we can see what we can do to find out if there's a possibility of getting a waiver. For just about every rule, there is an exception, luckily. And after my 25 years of working with Social Security and doing this type of work, I've learned a lot of them. And I'm very happy to educate you to be able to apply on your own or help you if you have applied on your own. Should you not want to engage someone else's services, I'm still here to help. And anything that I can do to make your journey simpler or a little bit more cohesive, please feel free to call at any time. And I think I'm just about out of time. If I'm right, please let me know or I'll go on for some more. I am, okay. So thanks for listening and please feel free to call and always stay in touch with your care manager.